Welcome, everyone. Thank you for joining us. We're going to give folks time to get logged in, and we'll be starting shortly. All right, for the folks just joining, welcome, welcome. We are anticipating about 3,000 people plus today, so we're going to get started in just a moment. Hey everyone who's just joining us, we're going to get started in just a moment. We anticipate close to 3,000 people. All right, I got some feedback that I was echoing, so hopefully, okay. Some people are hearing an echo, some people are not hearing an echo. So I apologize to the folks that are hearing an echo. Um, we'll do what we can to adjust. But thank you for joining us. I'm going to go ahead and get us started. We have reached over 2,100 participants today. You are joining the National Alliance to End Homelessness. This is our Understanding HUD's FY2026 Continuum of Care Program NOFO webinar. Next slide, please. And I'm excited to be joined by my colleagues, our Chief Executive Officer, Anna Leva, and Vice President of Programs and Policy, Marcy Thompson. Just in case anyone is new here to the Alliance and what we do, I'll just give you a brief summary. You know, our mission really spans across a broad scope of activities. We conduct research and analysis. We help build the capacity of the homelessness sector while working towards an end to homelessness through policies, by connecting communities, raising awareness and public will, and of course, working to expand the impact of lived experience throughout the field. Next slide, please. And we can move right along. Next slide. Just some quick housekeeping. We do have the chat function disabled, but you are more than welcome to introduce yourself and message the hosts for today's event, along with myself, Ann, and Marcy. For any questions that you may have, please, please, please use the Q&A function. I think the most popular question that we get on any of our webinars is, will the materials be available and is this being recorded? The answer for both is yes, yes, yes. We'll also be developing some accompanying documents based on today's webinars and the questions that we are asked. And in that vein, I want to note for everyone, we may not be able to answer every single question today live. So if we don't get to your question, please give us just a moment to kind of go through all of the questions and come up with an FAQ document similar to what we've done with the past NOFO in 2025. Also, last piece, we do have a code of conduct for our webinars, and I'm going to ask that we move right into the next slide so I can just give you a high-level overview of what that means and why it exists. So we value diversity and invite everyone to join in our webinar through the Q&A. We've got a strong commitment to preventing any discrimination, abusive behavior, as we strive to create a safe and respectful environment, not just for participants, but for us as panelists as well. While you are limited and can't see folks in the chat, if you have any issues that arise in today's webinar, please feel free to reach out to any Alliance staff member. And I'm going to let us get down to the nitty gritty and hand it over to Ann.
See. Hi, everybody. It's a pleasure to be here with you all today. I appreciate Mary Frances and Marcy being on this webinar with me, and to the more than 2,000 folks who are with us today. I know that this is probably a tough time. We have a lot of activity going on in our sector right now. And we hope that today, yeah, I don't think, Alec, I don't think that my video is up on the screen. There you go. Um, we hope that today we will be giving you the information that you need in order to make the best local decisions that you can make in your community. So before diving into the FY 2026 Continuum of Care NOFO, it does seem like we should provide some historical context, particularly in light of the policy narrative that HUD included in the NOFO and in a variety of their different materials, like their press releases. And before I dig into that, for those who don't know, I was a COC lead in Washington, D.C. in a former life. And then I was the director of the SNAP's office and later the deputy assistant secretary at HUD over the special needs programs. Marcy was a senior advisor at HUD and then a technical assistance provider. And Mary was a technical assistance provider in many key communities, I'm sure many who are represented here, as well as a continuum of care lead. Between the three of us, we have seen these programs from inside and outside of the federal government. So our analysis, the analysis that you get from us, is not based on theoretical information. It comes from a pretty deep understanding about how these programs should be working, what communities face in the real world, and what the law says. So if you could go to the next slide, please, Alec. But before we get started, I think it's worth taking a brief look back to sort of how we got here. And I'm not going to spend a ton of time here. Maybe there are some of you who are on this webinar today that have been doing this for 30 plus years, like I've been doing it, and you remember a lot of these things. But I just want to highlight a few important milestones in our time working on these programs. So most of you know that the McKinney-Vento Act passed in 1987, and it was reauthorized and modernized in 2009 with the passage of the Hearth Act. And before the Hearth Act, in the 1990s and the early 2000s, HUD's homeless assistance grants, which were 3 separate programs, provided the funding for the majority of the same costs that we now see in the Continuum of Care program. But the Continuum of Care concept was actually initially introduced as part of the Notice of Funding availability, the SuperNOFA back in the day, in 1994. And prior to that, prior to 1994, these programs didn't really have a system level, they didn't promote a system level response. It was a project by project competition that focused on project level outcomes. And over this period of time, we started to see the emergence of chronic homelessness as something for us to pay close attention to. And we also saw that a lot of projects nationwide were not serving the hardest to house folks because of those project level outcomes. They were nervous about adversely impacting their project level outcomes. And the impact of that was that we had people experiencing chronic homelessness that were not getting served in programs and communities. So in 2009, the Hearth Act codified the Continuum of Care program and the responsibilities of the Continuum of Care. So there was a focus on transparency, a focus on accountability, a focus on partnerships and collaboration. But I think most importantly, it shifted from our systems from project level, a focus on project level outcomes. Is project A doing better than project B? Or is how is Project A doing in relation to other like projects across the country? So focused from that to more system level performance measures. How is your system functioning as a whole? And when people leave homelessness, are they returning back to homelessness? And in this shift, once the Hearth Act passed, there was a very heavy emphasis on two things: permanent housing, which, as you all know, in the Continuum of Care program means permanent supportive housing, or PSH, and rapid rehousing. Both of those are under the umbrella of permanent housing. So the Hearth Act legally focused HUD on ensuring that people have access and funding for permanent housing programs. And it also put a very heavy emphasis on renewals, because permanent housing programs really rely on steady funding year over year in order to be permanent for the people who are served by them. Around the time of the Hearth Act passage and the issuance of the regulations for the Continuum of Care program, we saw the implementation of Opening Doors, which was the first federal plan to prevent and end homelessness. It was put out by the U.S. Interagency Council on Homelessness. It was reflective of a government-wide effort and really focused on a roadmap for federal response that included HUD, most importantly, HUD, the Department of Health and Human Services, and the VA. That plan was informed by years and years of practice and research, as well as a significant input that included input from thousands of people and practitioners from across the country. And the plan, it set some goals. You might remember them. But the goals that were set in that plan relied on the types of resource investments that would be needed. So, for example, the services that were included in that plan for people experiencing homelessness largely relied on the Affordable Care Act. That was the mechanism by which supportive services and healthcare and substance use treatment and mental health treatment would be scaled up for people who were experiencing homelessness. And Housing First was a key part of that plan, and that resulted in both the VA and HUD adopting Housing First for their programs over the next few years. And investments in those years, sort of combined with the implementation of both the Hearth Act and Opening Doors, led to consistent reductions overall for each of the key subpopulations for every year between 2010 and 2016. And you all might obviously know that this was especially true on veteran homelessness, where HUD housing could be paired with services being provided through the VA's healthcare systems. And I think I don't have to go into a ton of detail for this audience for you to know that the work done on veteran homelessness has been some of the most successful work to reduce homelessness among a specific population that we've seen from a public policy perspective in this nation. But as housing costs rose and wages started to become stagnant, at the same time that investments in permanent supportive housing sort of started to plateau, the number of people becoming homeless year over year increased. And then we started to see the number of people aging into chronic homelessness also increase. But even while COCs were steadily increasing, the number of people who were served and exited from our systems back into housing, that inflow that's related to the housing costs and wages really started to make keeping up with it an impossible task. And in 2024, we know that 17,500 people enter homelessness for the first time each week in this country. And our homeless services system is not actually funded to meet that level of need. So I'll end this slide just by saying I hope that folks don't take to heart some of the language that's been used by HUD in the NOFO and in other materials where they talk about housing first or blame housing first for the increase in the number of people experiencing homelessness. Because I think it is incredibly disingenuous after you understand the history of our programs and the outside forces that are increasing inflow into our systems, that housing first should be blamed for the systems who are sending people into homelessness to begin with. Next slide, please. Thank you for indulging me in that little history lesson before we get started. So before handing off to our in-house experts to discuss the details, I want to give a very broad overview of our perspective on the NOFO. Oh, thank you, everybody. I appreciate your comments in the chat. And first, because I know we're going to get questions, for those of you who are asking or plan to ask about litigation, please know that we cannot answer that question today. What we can say is that we're exploring and analyzing all options. All options are on the table, and that we're conferring with our members, we're conferring with key partners and our attorneys, and when you will know more when we know more. So stay tuned for all of that. And I just want to issue a reminder that today is focused on the Alliance's analysis of the NOFO. We're going to focus particularly on the changes and what we think they mean, but we are not HUD and we are not speaking for HUD. Nothing in this webinar should be taken as us speaking for HUD. As some of you have noted in the chat, there are inconsistencies throughout the NOFO document. There are some places where 55 is used to define seniors. There are some places where 62 is defined. There are two different numbers for the total amount available. So I could go on, but I will not. So we are not HUD. We are trying hard to just give you the information as we see it. And for any specific questions that we don't think we can answer, we're going to send you to the AAQ process at HUD. And to understand our concerns, I would encourage everybody on this webinar to take a close look at our written analysis, including the prologue section, which lays out a number of things, a number of broad thoughts that we have about what is in this NOFO and what we're concerned about. But I want to add one thing to that list that you can take a look at in the prologue section. HUD does seem to be continuing the practice of invitation-only meetings about this NOFO in violation of the HUD Reform Act. We really can't answer questions about that, but we do hear your concerns. People have noted it on the Facebook Hub. People have noted it in a number of different conversations that we've had. We hear you. We are also concerned about the degradation of the competitive process and what that violation may mean in the long run, but we actually don't have any answers for you in this webinar today. I just wanted to make sure that folks know that we're paying attention to that. So next slide. I want to boil our concerns, the things that are listed in the prologue and what Mary Frances and Marcy will go over today, down to three major categories. And the first is the actual funding processes. We obviously have a concern that Tier 1 is set at 60%. We think that that is too low, but that is the floor that was set by Congress in last year's appropriation. So HUD chose not to go above that floor, but we certainly have concerns around the impact that Tier 1 set at 60% will have on communities and people in permanent housing. We are concerned about the $1.3 billion set aside for new projects that have a priority for transitional housing and SSO programs that are not listed in the statute as proven strategies. So and the impact that a set aside for new projects has on the renewal of existing projects. So that's our number one concern. Our number two concern is about renewals and geography. Because of that $1.3 billion set aside for new projects, that is in effect a deprioritization of renewals and specifically permanent housing renewals. We think that that will have an adverse impact on the nation's homeless assistance response, and we are very concerned about it. We are also concerned about the geographic redistribution of funding through the bonus structure and through other things that we'll talk about over the course of the next several slides. And then the last sort of big bucket of things that we're concerned about is the fact that HUD has given themselves broad authority, much broader than normal, to reject projects on subjective and unclear criteria. This basically allows HUD to make whatever decisions they want, regardless of tier 1, tier 2, score, not score, based on these very subjective and unclear criteria, and we are very concerned about the impact of those decisions and those authorities. Next slide, please. But our number one concern is about the impact to people currently residing in permanent housing programs. We put this out last night. You can get to it through the newsletter that went out last night with the full analysis attached to it. But we conservatively, using the most conservative assumptions that we could use, estimate that 97,000 people will lose their permanent housing nationwide as a result of this NOFO. That number could be much higher depending on various factors, including how communities prioritize their projects, their renewal projects, where HMIS goes, how coordinated entry is treated. There are a number of things that could make that number go much higher than 97,000. Every single state in the country except Wyoming is projected to lose permanent housing resources through this process to varying degrees. And you can see that on the heat map that is on this slide and included in the analysis that we posted last night. So I encourage you to go to our website to see the full analysis and how your state or continuum of care could be impacted by this NOFO. So with that, I'm going to turn it over to Marcy Thompson to start walking through the fundamentals. Thank you, everybody. Really appreciate the chat that's happening.
All right. Good afternoon, everybody. And just briefly, we're seeing a lot of questions. As Mary Frances and I start to dive into the details, many of these questions will be answered. So just know that we're going to try to get to those. Also, I put this in the chat, but Anne noted some of the inconsistencies that exist throughout the NOFO, like the timing for when it needs to be submitted. You'll find footnotes throughout the analysis that we did to point to those inconsistencies. So we may not reference all of them here, but you can identify those there. And of course, thank you, Anne, for walking through all of that, reminding us how we got here. All right, so today we're really going to be focusing in on the portions of the NOFO that differ from prior years and that are likely to have the most significant and greatest impact. The deadline for application submission is August 26th, and in accordance with congressional direction, HUD anticipates making awards by December 1st. Next slide, please. So 4.040 billion is available for FY2026 through this NOFO. The Alliance estimates the national renewal demand, or ARD, which is the sum of all eligible renewals for the year, is just over $3.8 billion. Unlike most years, HUD did not add recaptured funds to the total amount, which would typically make as much funding available as possible. And them not doing that could be an indication of other plans for that money. In FY26, COC planning costs are set at 5% of final pro rata need, or FPRN, and Unified Funding Agency costs are set at 3% of FPRN. At least $104 million must be used for new domestic violence bonus projects. This combines the $52 million set aside by Congress in both the FY25 and FY26 appropriations. At least $430 million must be used for permanent housing projects for families with children, including new or renewal permanent supportive housing or rapid rehousing. This is in accordance with an annual statutory requirement, which has long been met. For example, our most recent estimate is that HUD already funds more than $900,000 in permanent housing projects for families. So it hasn't historically been included or called out in the NOFO, but it has always been there. Up to the next big set aside, and this is the big one, up to $1.3 billion is set aside for new projects that are ranked in Tier 2, with selection priority for new transitional housing and supportive services only projects. And finally, a project is eligible for renewal in this competition if your current grant has an expiration date sometime in calendar year 2027, and this includes projects that were awarded under the special NOFO and have not yet renewed. Next slide. So COCs are required, as most of you know, are required to rank all project applications, both new and renewal, into 2 tiers. The only projects that do not have to be ranked are applications for COC planning and UFA costs. Each COC has an annual competitive process before even submitting applications to HUD to determine locally, based on local needs and local data, what projects will be selected to submit to HUD and how they will be ranked in Tier 1 or Tier 2. There are no requirements in the NOFO that limit what types of projects can be included in Tier 1 or Tier 2. However, the selection process included in the NOFO this year may influence local decision making, and I will talk more about that later in the webinar. Next slide. So regarding the COC bonus amounts, HUD made some fairly significant changes to that amount this year. Can we do next slide, please? While the NOFO states that COCs may use up to 15% of FPRN to create new bonus projects, they also created a new minimum and maximum. Is anybody seeing the slide change here? I'm sorry. Okay. Hopefully it will pop up in a second. There we go. All right. I wanted the slide up because this is really complicated and it's helpful for you all to be seeing it as I'm talking through it. So in this NOFO, they say 15% FPRN or a minimum and maximum. How this plays out is they've identified a couple of different COC types. So a split COC is a newly formed COC that split off from another COC within the last 3 years and continues to, where that former COC continues to operate. The split COC can now apply for up to 15%, but no less than $250,000 and no more than $3 million. A COC that went through a COC merger sometime in the last 3 years can apply for up to 15%, but no less than $750,000 and no more than $10 million. A COC that is neither a split COC or a merged COC, they have a minimum of $500,000 and no more than $5 million. And then finally, a new tribal COC can apply for up to 15%, again, of FPRN, but no less than $500,000 and no more than $5 million. So I want to talk through a few examples to kind of see how this plays out. Next slide. All right, so I've made up some names here. This is all fictional. So the fruit salad COC was comprised of multiple counties. In FY25, HUD approved 2 counties to split from the COC to create 2 split COCs, Banana County COC and Coconut County COC. Their bonus, because those 2 COCs are now considered a split COC, will be based off of the minimum or maximum for a split COC. So in this scenario, for Banana County, their FY26 bonus amount will be $250,000, even though the 15% of their FPRN is only $75,000. So they will get an increase. Coconut County's bonus amount will be equal to 15% of their FPRN because it's between that minimum and maximum amount. The fruit salad COC itself is considered the original still operating COC, and they're going to fall under that neither split or merged COC. Next slide. Or no, yes, next slide. Okay. I'm not going to talk through all of these scenarios, but in the next one I want to speak to, because this applies to probably most COCs here, is just what I'll say are regular COCs, meaning you haven't had a split or a merger. So Stranger Things COC can apply for $500,000 bonus, which is $450,000 higher than what their bonus would be based on 15% of FPRN. That fruit salad COC from the last example, their bonus is going to be based on that 15% because it's $2 million, and that's between the minimum. And finally, the Game of Thrones COC would be eligible to request $10 million in COC bonus funding based off of what that 15% would be. However, because of the cap, that new maximum, they can only request $5 million for their COC bonus. So those are some pretty significant shifts, and you'll hear more about some of that later. All right, next slide. There are also a number of programmatic sorts of changes that are included throughout the NOFO. These are all highlighted in the analysis. I want to just talk through a few of those today. So first is projects, so permanent supportive housing projects. Historically through the NOFO have been limited to serving people with disabilities who meet Category 1 and Category 4. That is not a statutory or regulatory limitation. It is historically been implemented through the NOFO, giving priority to people who are unsheltered, in shelters, and people who are now in transitional housing but were once from those places. This year, HUD has said projects that are not dedicated to chronically homeless households or designated as dedicated plus may now also serve people with disabilities who meet Category 2 of the homeless definition. This does not mean you have to change your eligibility. Your COC's prioritization and coordinated entry policies still are in effect. It just means that this population would be eligible for any PSH that, again, is not dedicated to the chronically homeless and not dedicated plus. Projects that are coming up for renewal for the first time are also eligible for reallocation. That is new. Typically, or in the past, projects could only reallocate or be reallocated after being renewed at least once. Next slide. The FY2026 Consolidated Appropriations Act included language that said recipients of funding could establish preferences for elderly individuals and families. And I think it's just important to note that while projects are allowed to have preferences for this population, there is nothing in the NOFO that would give priority to projects for doing so. And Anne mentioned earlier, there's an inconsistency around who is considered elderly and whether that's 55 and older or 62 and above. We do not know, but just pointing out that inconsistency is there. Transitional housing is added as an eligible project type for the DB bonus. And then the last thing I want to highlight is how HUD is defining self-sufficiency. So self-sufficiency is a goal of the program. It always has been. It has long been considered simply the ability to live independently and maintain housing with or without assistance. HUD is now interpreting this to mean, based on the Oxford English definition, the ability to meet basic needs, including a place to live without public or private assistance, meaning their expectation is that to achieve self-sufficiency, people are exiting programs without any form of assistance, not rental assistance, not SNAP benefits, not Medicaid, no assistance whatsoever, which does not feel like a reasonable expectation, particularly in today's housing market and economy. Next slide. All right, so now we're going to talk about what HUD's going to be considering when reviewing projects. So we can go to the next slide. All right, so all projects, new and renewal, always have to meet a standard set of criteria, threshold criteria, eligibility criteria on a pass-fail basis to receive funding. Renewal projects are considered to have already met these requirements previously. However, it is important to note that there are two additional criteria for which that will apply to both new and renewal projects. So first, HUD is requiring project applicants to certify that the organization will not engage in racial preferences or other forms of illegal discrimination, which we read as anything flagged as DEI from HUD's perspective. And also will certify that they will not operate safe consumption sites or engage in activities under the pretext of harm reduction. As this is written, the way that we interpret this is that this certification applies to the organization and not only to the use of funds that are being requested in this competition, which is very significant because it would limit what you would be able to do with other funds and for other purposes. They also add language that says HUD reserves the right to verify past performance and evaluate the eligibility of a project application to ensure that it can adequately manage federal awards and comply with federal laws. This feels both duplicative of what they've already reviewed as part of the this review process, and also vague enough that it can be a catch-all for lots of things that they feel makes the project unworthy for award. Next slide. So renewal projects, in addition to that criteria that we just talked to, always have to meet renewal project threshold requirements that look essentially at how have you managed the project in recent years. That's all standard. What is new this year is just noting that they added compliance with audits for large grant recipients over $1 million or more. So just wanted to make sure you saw that. Next slide. Then there is the minimum requirements that HUD establishes around program design for new projects, and all of the criteria that are included in the NOFO for each project type must be met by the point of grant execution. So pretty much all of the components include criteria associated with reasonableness of costs and leveraging of mainstream programs like Medicaid and SSI, which is interesting given their thoughts on self-sufficiency, but that is in there. Some project-specific highlights. New transitional housing projects must ensure that all program participants are provided individualized services that will result in at least 20 hours per week of engagement in services, activities, or employment for all program participants. There is an exception for people over age 62, people who meet the definition of handicap in 24 CFR 8.3, and or those who have a developmental disability. A really big flag here. The use of the term handicapped in this context, as opposed to using the term person with a disability as defined in the McKinney-Vento Act, excludes people with HIV/AIDS, as well as many people whose primary diagnosis is a substance use disorder who would otherwise meet the McKinney-Vento Act definition. The FY2026 NOFO includes 3 types of supportive services only projects. So just as a reminder, these SSO projects are not just projects that only have a supportive service line item. They are projects that are not connected with housing, and they are specifically for people who are currently experiencing homelessness. The 3 different types are standalone projects, street outreach, and coordinated entry. The street outreach projects must demonstrate a history of or plan for partnering and cooperating with first responders and law enforcement. And finally, just want to note that new permanent supportive housing and new rapid rehousing projects do not have service participation requirements in order to pass this threshold. There are other incentives for this throughout the NOFO, but it is not a mandate as part of this section. Next slide. All right. And I've seen a few questions about what I'm about to cover, so hopefully this will answer some of those questions. Reallocation, as you know, it's a process where a COC can move funds in whole or part from an eligible renewal to create one or more new projects. In FY2026, a new reallocated project can be both for and from any component type. So you can create any type of new project, and you can reallocate any type of project. Reallocated projects are intended to be entirely new projects. Therefore, the operating start date is not retroactive to the end of the expiring renewal grant. The start date will be at whatever point the grant agreement is executed, and it's important to keep in mind that executing grant agreements for new projects typically happens after all renewal grants have been processed, so often there's a gap between when the renewal project ends and when the new project would begin. Transition grants are a type of reallocation whereby a recipient can reallocate funds from an existing project to a new project where they are still the recipient and the new project is a different component type. Transition grants are different from standard reallocation because if awarded, the recipient essentially has a year to wind down the current program type and then before the new project begins. So essentially, if you're a PSH that's reallocating to a transitional housing and it's awarded as a transition grant, you would have a year to wind down the PSH portion, PSH project and be ready upon renewal to begin operating the transitional housing. Unlike regular reallocation, they have an operating start date on the day after prior renewal grant expires, so similar to a renewal grant, and there wouldn't be the same gap in funding or potential gap in funding. As you're considering these decisions, there are a few things to consider. So first, if considering a reallocation or transition grant, because they're the same, from a rapid rehousing or permanent supportive housing to transitional housing, please keep in mind, program participants in permanent housing projects are housed and are not homeless. Transitional housing requires program participants to be homeless at project entry. So even though there's allowances for program participants in permanent housing projects to maintain eligibility for a project transfer, that only applies to a project transfer into permanent supportive housing, and that's for both rapid rehousing and permanent supportive housing. You really aren't supposed to, or you aren't generally allowed to transfer people the other direction or have permanent supportive housing folks go into rapid rehousing. So HUD has put out recent guidance that talks through how somebody that is currently in permanent supportive housing or any permanent housing could become eligible or could be considered eligible for a TH project. So there needs to be a referral from coordinated entry, and at intake, the individual or the household would have to meet one of the following. They are fleeing or attempting to flee domestic violence, their lease expires within 14 days, or there's an eviction process that has been initiated in their current housing and they must vacate the unit within 14 days. And in each of those circumstances, they also have to be able to demonstrate that they do not have another residence, do not have resources or support networks to obtain other permanent housing. So in order to be eligible, it is not simply the grant has been reallocated and those funds don't exist anymore. It is they have to essentially meet that category 2 definition, and the way to do that is through those mechanisms. So it is not a simple transfer or transferring in place. The other piece that we've heard a lot about, and this is not stated in the NOFO, but we want to make sure that people are aware of it. So nonprofit organizations are not authorized to administer rental assistance and COC-funded transitional housing. While the statute was amended years ago to add nonprofits as an eligible administrator of rental assistance for permanent housing, that allowance does not extend to transitional housing. And so a nonprofit that wants to apply for transitional housing could either use leasing dollars or contract with an eligible entity who is authorized to administer the rental assistance in that project. And now I'm going to hand it off to Mary Frances, and I will go and engage in the Q&A.
Thank you, Marcy. Next slide, please. All right, folks. I want to spend, oh, okay, that's fine. I want to spend a little bit of time talking through merit review. For those of you who have been doing NOFOs since they were NOFAs, or even as far back as when they were paper applications, this used to be called the COC scoring criteria. And what we're seeing this year in this particular NOFO is that HUD has removed or significantly adjusted previous criteria and added new criteria. So there are a total of 200 points available across 3 rating areas. And I'm not going to read the slide verbatim, but the bulk of those points are actually concentrated in COC coordination and engagement. There are also 20 bonus points available. Those bonus points are available for COC merger or UFA and some policy initiative preferences. Next slide, please. All right, so now I'll dive into the scoring criteria for project capacity, review, and ranking. So this is the smallest number of points available and is really focusing on the existence of a coordinated, inclusive, and outcome-oriented community process. So this is your competition process that you're being assessed on, including the solicitation, objective review, ranking, and overall selection of project applications using the criteria that is described in the NOFO. So they're looking at factors such as your local ranking and review process, considering returns to homelessness, commonly referred to as recidivism. Of note, increased employment income. So not income from benefits, just a focus on increased employment income and supportive service participation requirements for any of the proposed projects. Additionally, they're looking at the number of, or the amount of funding that's been reallocated between fiscal year 21 and fiscal year 26. We do not have a sense of how HUD will factor in any projects that were proposed for reallocation as a part of the FY2025 NOFO process that weren't approved because of Congress's directive to HUD to make awards for FY25 on a non-competitive basis. And that was, again, at Congress's direction. Last piece here before I move on to the next slide, the consolidated application coming from the COC does require that all documentation related to your COC's review, score, ranking, selection, and notification process is documented. So that's pretty consistent with years prior. Can we go to the next slide, please? So moving into system performance, and I'm going to highlight some key changes here. So for this section, HUD is going to award points based on system-wide performance measure process, really focused on reducing homelessness using some criteria. And that criteria is going to include a review of statutorily required system performance measures. And this is new, so I'm going to flag this, the extent in which COCs have reduced the number of encampments or the number of people residing in encampments. And unfortunately, folks, this new measurement on encampments does not include a definition of encampment, nor does it include a way to measure such reductions. So this is going to be significantly subjective, and I would encourage you all to send a note to the COC NOFO inbox and request some additional clarity about how encampments are defined and what the expectation is to measure, the number of people residing in encampments. They're also measuring as a part of system performance, both significant and consistent reductions in homelessness, as reported in the point in time counts, and this goes back to 2024. And then we also have another measurement, which I briefly mentioned a moment ago, the income growth, and I want to start there. This is, I can't emphasize this enough. They are looking at income growth from employment only. There's no consideration for program participants that you have to use non-employment sources of income, such as Social Security income. So you all will be measured from a system performance perspective as it relates to employment only income. The last point that I want to make before we move on is that there's an additional measure on the percentage of program participants that exit COC funded housing to unsubsidized housing with a goal of at least 20%. So that's additionally something that we're seeing that is new. And it's excluding non-employment income, even though that is included in our sort of standard system performance measures. Next slide, please. So the sort of meat and potatoes of the merit scoring for this NOFO sits squarely within COC coordination and engagement, so a total of 122 points. For this section, HUD is going to be looking at coordination with other systems of care. And I'm just going to highlight some of the criteria, not all of the criteria. But of note, we're seeing expanded governance, requirements that include elected public officials and representatives from the business community, law enforcement, recovery housing, healthcare, or behavioral health, and or a court system that manages civil commitment processes. There's also a lot of weighting on the availability of treatment and recovery services, which unfortunately are going to impact some COCs more than others, just because we are, I think as a field pretty well aware that we've been experiencing a shortage of treatment and recovery services for many decades now. So specifically, they're looking at on-site substance use disorder treatment being available for at least 30% of housing projects. There is an exception for rural COCs. There's a focus on the use of the civil commitment process. So, being able to involuntarily commit people. Then we're just seeing a growing trend dating back to last summer when the president's executive order came out around the use of civil commitment as a strategy to address homelessness. They're looking at 24/7 access to detox or inpatient beds, which again, depending on where you are in this country, you may not be able to maximize points based on this criteria. We're also looking at having at least one unit per 2 people reported as having chronic substance use in most recent PIT count. And to kind of move us along, because again, COC coordination and engagement has a lot of points associated with it and subsequently a lot of criteria. They're also looking at adequate investment in services, and the way that this is being assessed is demonstrating 50% match costs or 30% of the award. There's also, they're looking at the percentage of projects that have service participation requirements. So 100% of projects would need to have service participation requirements in order to get full points for this section. Next slide, please. So HUD is also planning to award points to COCs that, coordinate again with other systems of care. Some more examples of this that are cited in the NOFO is the extent to which COCs or recipients assist with family or support network reunification efforts. They're going to be evaluated on demonstrating how public safety is being protected by providing evidence of cooperation with first responders, which is something that Marcy already addressed. But again, you all are going to be required to identify local and state laws, policies, or practices to quickly clear encampments, decrease the public use of illicit drugs, use options like involuntary commitment to address folks experiencing homelessness who are a danger to themselves or others, and also share information with the SORNA, which has to do with sex offender status. So there's a heavy emphasis on public safety. I think my interpretation is certainly when referencing public safety, that actually excludes the safety of people experiencing homelessness, who are more likely to be impacted by being unhoused, particularly if they're outdoors. So as you are approaching the application process, COCs are going to have to describe how they will leverage these quote unquote beneficial laws and policies while overcoming those that are restrictive. And last thing here, before I move on to bonus points, the COCs are going to be, I hear boo in the chat, and I agree, Liddy. The COCs are going to be evaluated on how they're responding specifically to certain subpopulations. So that includes children and youth, families with children, veterans, survivors of domestic violence, folks who are involved in the criminal legal system, frequent users of healthcare systems, the aging population, as well as chronically homeless individuals and households. Next slide, and I will round us out with talking through bonus points. So there are a ton of bonus points here. You can either get up to 6 points for COCs that merged after the FY24 COC program registration deadline, as well as COCs that have that Unified Funding Agency designation, and that is underneath the COC merger or UFA umbrella. And then on the policy initiative preference point side, collaborative applicants get up to 4 points if proposed activities are within an opportunity zone, or up to 10 points for COC policy or statement that ensures no project will operate drug injection site or safe consumption sites or any related activities under the quote pretext of harm reductions. So just to clarify, to receive the maximum of 10 points, this policy submitted by the COC must include that all projects will prohibit, safe consumption sites. It will describe remedies for any violations of this. The statement must encourage the provision of substance use treatment and recovery housing, and also not restrict or prohibit projects to have sobriety mandates as a condition. This is really, if I had to highlight anything here, this is a huge departure from harm reduction. And it's just really unfortunate, but I'm going to go ahead and turn it over to Marcy now, who's going to walk us through the selection process. Marcy?
All right. I know this is a lot of information, y'all. So I'm going to talk through what I consider probably the most complicated part of this NOFO and maybe the most impactful. So whether or not a project is awarded depends on a multitude of factors. It has to pass all of those threshold requirements that we talked through. The COC's score on the merit review that Mary Frances just talked through gets factored in, and then how it is ranked on the priority listing. But it doesn't stop there. Next slide, please. All right, so there's always a risk review. Like every year you go back to the NOFOs, you do a word search, you'll find a risk review. And typically those look at things like financial controls, effective management systems, results of audits, etc. However, in this year's NOFO, that list has been expanded to include criteria that is pretty subjective, and it is unclear how these things will be measured, scored, what they'll be looking at. So first, public sources such as newspapers, IG or GAO reports or findings, or other complaints that have been proven by who to have merit. Ability to follow all required laws and rules, and ability to promote self-sufficiency and economic independence. I'm not sure how ability is measured in this context, and they do not provide any sort of transparency or definition, even what they're going to look at in around this, and why this is so important. So typically, with the risk review, more often than not, HUD will use that information, and if there's a flag, typically the project can still be awarded. It's a curable deficiency, and the grantee has an opportunity to correct whatever it is, to be able to work on that. And it's a part of kind of looking at the overall, all of those other factors. This year, HUD has added language that we haven't seen before, that essentially says the risk review alone can be considered sufficient to make an adverse funding decision, including rejecting a project. So I think Anne mentioned this as kind of the top three concerns earlier. There are multiple places throughout this NOFO where HUD has inserted language that appears to allow them to make decisions on criteria that is not objective, that could result in a project being rejected and not move forward, even if it met all of those other factors, even if the COC scores really well on the merit review. So this is really problematic. I will also, on the next slide, in addition to that risk review, they've also added this other criteria that they say that they can consider when making selection criteria. Again, unclear, subjective. For example, projected impact on program and administrative goals and priorities, the likelihood that a project will result in the benefits expected. If you're thinking, like, how will they determine that? So are we. It is completely unclear. And again, concerning and problematic. So next slide. So some things to consider when it comes to Tier 1 and Tier 2, thinking through this. There's a local competition that you all have every year, even though we keep hearing that there's no competitive process. We know that there's a very robust local competition that happens every year in COCs. And those local competitions determine what projects to submit to HUD and how those projects will be ranked based on local priorities, local data. Projects ranked in Tier 1, which is 60% of the annual renewal demand, are kind of considered safe as long as they've met the threshold review and they've met all of they've gone through the gauntlet of other considerations and survived. Projects in Tier 2 must also meet all of those requirements, but then there are some other considerations that factor in. Each project in Tier 2 is assigned a project score on a 100-point scale that takes into account 50 points, up to 50 points for the COC score on merit review. So it will do better. It will have a higher project score the higher the COC score is. The project's ranking, so the higher the project ranking on the COC's priority listing, the higher that point amount will be. And then the extent to which the project will require participation in supportive services. So, and that's up to 10 points. So that is where there's a hook to add participation requirements at the project level. Next slide. So the NOFO establishes the selection process for how projects are going to be picked for the award until all available funds have been expended. This again is normal, happens every year. This year it is more complex than usual with very far-reaching implications. So first, off the top, COC planning and UFA cost applications will be selected. Those are non-competitive and they're awarded off the top. Next is all projects in Tier 1, again, that have passed all of those other requirements and are deemed eligible. Those will be awarded next. That's 60%. And any project can be put into Tier 1, new, renewal, any component type. After Tier 1 is awarded, HUD will move to DD bonus projects, starting in Tier 1 and selecting all DB bonus projects until they reach that $104 million. Once that set aside is reached, either in Tier 1 or Tier 2, HUD is not going to select any more DB bonus projects under this selection priority. Those projects could be selected under one of the later selection priorities, but lower down on the list. So that's pretty important to know. After the DB bonus set aside, HUD is then going to select those permanent housing projects for families with children, starting in Tier 1 and selecting them by project score until the amount totals $430 million. And then again, similar to those DB projects, any other permanent housing projects, new or renewal, that were not picked up in that $430 million set aside will be considered in one of the other selection buckets for new projects or when we get to renewals. So then there's this $1.3 billion set aside. It only applies to new projects ranked in Tier 2. So new projects ranked in Tier 1 do not get applied to this $1.3 billion set aside. There's only so much funding available. 60% is for Tier 1. What is available in Tier 2 is not a huge amount, and this $1.3 billion probably consumes the vast majority of that funding. I think we've estimated somewhere around potentially 200 million, a little over 200 million could be remaining after this 1.3 billion set aside. But again, as Anne mentioned, all of this is dependent upon so many different variables, so it's really hard to estimate this accurately. So for that 1.3 billion, they're going to start at the top of Tier 2, select transitional housing projects and SSO projects, any type of SSO that are ranked in Tier 2. They're going to go down the list based on project score. If there are funds remaining in that set aside after picking all of the transitional housing and SSO projects, then they'll move on to other new types of projects, or other types of new projects rather. So again, that could be new permanent housing. And again, this could be bonus, reallocated, transition. Any type of new project can fall into this 1.3 billion. So in that, they've picked everything, all of the TH and SSO, then they move on to other types of new projects. Once they reach that 1.3 billion, they stop. Any new projects that are submitted beyond that 1.3 billion are automatically removed and are not considered for funding. There's not another opportunity for those to get picked up somewhere else. So that is like all of the 1.3 billion set aside, then there's a stop. Whatever's left at the end of that is when renewals start to get picked. And they will start picking renewals, again, if there's funding left, starting with those Tier 2 project scores. The most critical takeaway here is really regardless of what project type it is or how it is ranked, renewal projects ranked in Tier 2 are at very high risk of not being awarded. So that means there are some even harder decisions to be made here around what gets put into tier one, because most likely or high likelihood projects in tier two for many communities will not be selected. Renewal projects specifically will not get selected. Um, Next slide. The last thing I want to mention, and then I'm going to hand it back to Anne, I believe, is about solo applicants. So, the statute allows for solo applicants to submit an appeal to HUD outside of the COC process if they believe they have not been able to participate fairly in the local competitive process. Um, the statute is very clear and specific that this is only an appeal around participation. Um, and uh, and these types of appeals can be granted when there is proof that they were excluded from participating in a reasonable manner. The solo applicant process or the solo appeal process does not apply, is not intended in the statute to apply if an organization disagrees with a local decision. If they were able to apply just like every other organization, if the information about your ranking criteria and selection process, if all of that was made available to everybody equally, uh, there's not a case to be made as long as everybody had the same opportunity. If you did not even let them in the front door and you blocked them from the email list and didn't let them participate, that is grounds for when a solo appeal might be considered. What's important here is that when there is an appeal, uh, it will likely impact the amount of funding that's awarded for the COC that solo applicant is otherwise geographically a part of. The reason for highlighting it is because HUD has been talking about this a lot. They've been talking about it in press releases. They've been talking about it in roundtables. They've been talking about it in webinars. And so it just feels like they're implying in these conversations that the solo appeal process is an opportunity rather than an exception to the rule, whereas historically it's always been, um, you know, the exception. Ultimately, it's going to be up to HUD to determine what a reasonable manner means, and it's likely not going to be very clear how they're making those determinations. So just want to make sure that is on everybody's radar to be very clear and transparent about your process overall. This feels really even more necessary than usual. So I'm going to turn it over to Anne on the next slide, who's just going to talk a little bit about what we see as the potential impact on COCs when taking all of these changes into account.
Great. Thanks, Marcy. Thanks, Mary Frances. So we've just gone through the entire sort of competitive process. After this, we'll do a quick overview of the post-award process. We won't spend a ton of time there because we want to get to Q&A. But I think after listening to, thanks, Rachel, that's exactly what I was about to say. After listening to this presentation and understanding sort of the inconsistencies and the changes and the potential impacts, I think if anything describes this process, it's this sort of spaghetti in the middle with a question mark in it, right? Like we actually don't know what the true impact will be to communities. We are making well-informed and I love the chat, well-informed and educated projections about the harm that we think will be caused. Again, we've been the Alliance, we try to be as even-keeled as possible, and we are making very conservative projections. But we do know that this is going to be harmful, especially for people who are in permanent housing programs that have stabilized their lives over over time and that rely on the services and housing that is provided in order to do well and sort of reach their own goals. But when we think about this, I would encourage you all to think about this impact both in the short term in terms of impact to programs in your community, what the uncertainty continues to do to programs in your community and the people that they serve, like what's happening right now, but also think about this impact in terms of the coming years. You know, the defunding of permanent housing for 97,000 people impacts 97,000 people today, but those units turn over time and they will not be available to additional members of the community when they need it as they turn over either. So there's a lot to think about here when you're thinking about not just about how to put together an application, but about what your community system needs to look like. And then the last thing I would say that we think about a lot is what does this NOFO standard set for the rest of this administration? And what does it mean over the next, 2 to 3 more years? So we would just encourage folks to think about that as well. I know that's it's all concerning, but I think it's important for all of us to go in eyes wide open to all of this. So briefly, we're going to talk about post-award and post-award requirements. So Mary Frances, I think you're up, and then I'll handle Q&A.
Thanks so much, Anne. We can go ahead and move forward. All right, so we've seen this before, you all. Many of the post-award conditions have to do with the flurry of executive orders that we've seen in the last 18 months. I have not listed, we've not listed all of them, but these are just a few to highlight, which basically includes new provisions that awarded projects will be required to comply with. This includes I'm using bunny ears, even if I don't have my bunny ears up, because much of this language is not language that we would use, but including eradicating anti-Christian bias, ending illegal discrimination and restoring merit-based opportunity, defending women from gender ideology extremism and restoring biological truth to the federal government, ending radical and wasteful government DEI programs, which I take great exception to and preferencing. So we are continuing to see this sort of ideological agenda pushed. We're seeing it not just at HUD, but they're trying to make this a thing for all grant agreements across all federal agencies. Many of you who received Q1, grant agreements had an addendum to it. We fought back and were successful in having that rescinded. So you should have gotten rescission notices, but this is more of the same. Next slide, please. There are other compliance provisions, all situated around the illegal racial discrimination, racial preferences. There's a clause in there about not violating or interfering with religious beliefs and free exercise of religion. And of course, doubling or tripling down on the operation of drug injection sites or safe consumption sites. Next slide, please. The last piece that I want to sort of amplify before I turn it back over to Anne and we can get to some of the Q&As and the Q&A chat. While HUD has clarified in prior NOFOs that it may apply the remedies at 2 CFR 200, 339 or impose additional conditions to remedy noncompliance with, federal, state, local statutes, regulations, or terms and conditions. They say we may terminate. That's after exhausting remedies. So, for example, if you were in violation of compliance with your grant agreement, historically, HUD may assign you a technical assistance provider to help you course correct whatever the issue is. However, in FY2026, HUD has modified this language, and it states very clearly that HUD may terminate all or part of an award if it, quote, no longer effectuates the program goals or agency priorities. So this is another deep concern that we have, and I'm going to turn it back over to Anne to talk a little bit about what is coming, and then we'll dive into the Q&A.
Thanks, Mary Frances. I appreciate how fast you got through that. So what's coming? We're going to be releasing some additional analysis today around the impact of this NOFO. So keep an eye out for those links that will be going out today, including the COC by COC analysis that I mentioned earlier. We're going to continue to send out information via our normal channels and already scheduled calls for folks who participate with us in a variety of different ways. So again, be on the lookout for that. It's going to be really important for folks to continue to read the CEO Corner and the Tuesday newsletter and participate in calls as they are normally scheduled, so that we can release information as quickly as we can. Also, we will be releasing our Hill strategy. We have Capitol Hill Day coming up. We will be talking with advocates about continuing to educate your lawmakers and talking with your local elected officials to get the word out about the impacts here. So we have a number of things that we're working on and that will be out as soon as we can get them out to you. We've been not sleeping a whole lot. Probably you all haven't either here at the Alliance, trying to get these materials out so that you can use them and make good decisions, or at least the best decisions you possibly can at the local level. And really what I want to say before we get to Q&A is, please know we are in your corner here at the Alliance. We are doing everything that we can to make sure, again, that you have what you need in order to make the best possible decisions at the local level. We are looking at all options on the table. Our membership is incredibly, incredibly important to us, and we are in your corner all the time. You know how to reach the three people on this call, as well as Josh Johnson, who I see on the call. So please reach out to us if you need additional information. And with that, I'm going to turn to the first question because we don't have a ton of time. And the first question that I wanted to flag is for Mary Frances. Can you talk a little bit about YHDP? Where is the question is, YHDP, is it not protected this year? And what does that mean? Or do you want Marcy to take it?
I want Marcy to take that.
Marcy, can you take that one?
Okay. Yes. So it just means in years past, YHDP and DV bonus were both awarded non-competitively. This year, DV bonus and YHDP, both of those types of grants have to be ranked, but DV bonus, it's treated as a set aside and has that protection in terms of selection. YHDP renewals are just considered as part of all of the other projects that are submitted. So that's what we were flagging.
Great. Thank you so much. So Marcy, back to you again. This is just sort of a repeat of something that you highlighted. It's just come across a lot in the Q&A. Is it true that nonprofits cannot use rental assistance dollars in a TH project if they transition from rapid rehousing to transitional housing?
Yes, it is true. The statute was amended to allow nonprofits to administer rental assistance, but it only applies to permanent housing and does not apply to transitional housing. So that limitation is true. If you submit a question to the AAQ or the COC NOFO, they have a standard response that they'll be able to send you on that, because that comes up a lot.
Fantastic. And then here's a regulatory question also for you, Marcy, I think. Is there any way that supportive service only grants can be provided for permanent housing residents?
I see why you chose to facilitate, so you didn't have to answer the question.
I know, so smart on my part.
So the short answer is no. SSOs are in the reg, very specifically to serve people who are unsheltered and sheltered. I forget that sometimes. HUD has been very clear that if you have a PSH project and the only line item is services and the housing is provided by another entity, it is still classified as a permanent supportive housing or rapid rehousing, whichever permanent housing type it is.
Great. I will take the next one just because Marcy made a snarky comment about it. There's a number of questions about whether coordinated entry is still required, and my very simple answer that I would ask my colleagues here, Josh, Mary Frances, or Marcy, to weigh in on if needed, is yes, coordinated entry is still required per the reg. The reg has not changed, so please make sure that you're compliant with the regulations as they currently stand in your COC. We good? All right. Moving on. I know I'm sort of, let's see. Can you please clarify if there is a certain percentage HUD is using when the NOFO states primarily or exclusively serves families with children? For example, a program serves 80% families, but also serves individuals. Does that count as primarily?
That's a COC NOFO question. I think HUD did not specify, and we would not be able to answer that.
Yep. That is the same answer I would have given. Okay. Here's one. I'm concerned about this priority. New national priorities for HUD. HUD's new national priorities center on treatment, service participation requirements, civil commitment, and public safety. Merit criteria provide significant points for COCs that prioritize both voluntary and involuntary treatment and what HUD deems as promoting public safety, in quotations. Service requirements feature prominently in the merit criteria and selection criteria. Mary Frances,
I
you
have
want to take that one?
I have lots of thoughts about that. I think we're deeply concerned about it too. It's more disguised as what we've seen across both COC builds, NOFOs, and the two bad NOFOs from the fall of or winter of 2025. Um, I mean, we didn't get here alone as a sector. And what I mean by that is our systems were not designed to bear all of the weight that we have to carry. And a part of that weight has to do with the lack of access to high quality, accessible, affordable behavioral health care in our country. So I'm not saying that people at large, not just people experiencing homelessness, should have access to these things, but the reality is that they just don't. And certainly for many people experiencing homelessness for a myriad of reasons, they also don't have access to this. The big beautiful bill, I think Marcy uplifted that earlier in her remarks. That happened. Medicaid is being cut. Affordable Care Act subsidies have expired. There is no path forward. So it's interesting and very rich that there are these very prescriptive requirements for treatment when the treatment that they're referencing doesn't exist in most places. So I'm getting a little amped up now, so I'm going to stop there.
Okay. Another question, I'll do maybe two more, and then we'll sign off for today. We'll be trying to address as many of the questions as we can through other means after the webinar that came in through the Q&A, but let's take two more, and I'll take this one myself. It says, I submitted this question to HUD, but was wondering if you had any insight on whether the PH for Families priority / set aside of $430 million is likely for projects that exclusively serve families with children, or could this also include projects that serve families with children and singles? So while I can't answer for HUD, what I can say is this $430 million set aside is not new. It's actually supposed to be 10% of the total is for families with children of the COC total. That has been in the statute since before the Hearth Act. So while this is not a new requirement, how they calculate it, I think, will be up to them to answer. I will tell you how we calculated it. We actually prorated all of the projects based on how many people and families versus singles were served, so that we could accurately determine at which point in the total amount of funding available in our projections, like where that fell. And based on our projections, there's a little bit more than $900 million total. That is, did I just say that right? Yeah. $900 million total that's spent on projects that serve families with children, including exclusively families, and prorated for the projects that serve both families and singles. That's what made sense to us, but HUD will have to answer your question. Okay, was that two, or do I have one more to go? Okay, I think I probably just need to wrap us up. We're at 3:01, and we really appreciate everybody's time. Thank you so much for being with us today. Thank you to Marcy and Mary Frances and the team in our homelessness research team. HRI did an incredible job of analyzing this data under a very tight time frame so that you all would have the information that you need. Marcy and our P&P team did a wonderful job of putting together not just these slides, but the materials that are on our website. And thank you to all of you for continuing to persevere and continuing to do the work that's needed for people experiencing homelessness every single day. We are so appreciative of all of you. Continue to check out our materials on our website and through the newsletter, and ask us questions when you need to. Thank you, everybody. Take care of yourselves.